Hey, Vincent, stop staying inside.
What do you want me to do?
Go outside, play.
Fine, I'll play basketball.
Alright, then don't break a bone.
Alright.
Hey, Vincent, go play with your friend over there.
Hey, trash bag! Let's play! Okay. Basketball over here. Get ready to get school. Ow. Kevin! Help me!
Oh no! Are you okay? What happened?
I think I sprained my arm.
Alright, let's go to the hospital.
Oh wait, I can't stand up like this.
Hey, wait, man. So, son, how's your day?
It's gone bad.
I told you not to break your bone.
It's a kid's fault, not my fault.
You want some pizza after school? I mean, hospital?
Yeah. After school. Ow. My arm hurts.
Alright, I'll get you some
Are we
pizza
there yet?
after. Yeah, we're here.
We're finally here.
Get out of the car.
My arm hurts.
We need Dr. Miguel!
Take a seat, please.
Alright.
Okay. Dr. Miguel!
Did someone call me?
Dr. Miguel!
Oh, the Liu family. Is that right?
Yes.
Well, why are you guys here today?
I broke my arm. Or, I think I sprained it.
Well, I don't see you guys often here. This is your first time?
Yes, it is.
Yes, it is, sir.
So you think you sprained your arm? You think?
Yes, I think I sprained my arm.
Well, I have something that can help you tell if you actually broke it or not. Have you ever heard of something called an X-ray?
The X-ray?
Yes, the X-ray.
How does it work?
You really want to know?
Yeah.
Well, X-rays are highly penetrating ionizing radiation. Therefore, X-ray machines are used to take pictures of dense tissues such as bones and teeth. This is because bones absorb the radiation and more or less dense soft tissues. X-rays from a source pass through the body onto the photogenic cassette.
Wow. What can I expect from this X-ray?
Well, you can expect the machine will produce a safe amount of radiation for it to pass through your body and see specialized plates. Well, you can't feel the X-ray. Technologists like me will position your body to obtain necessary views. I will probably put pillows or sandbags to hold you in position. So during the X-ray exposure, you'll remain still and sometimes breathe to avoid moving so the image doesn't blur. An X-ray procedure may take a few minutes or up to an hour, so better not move, okay? That's what you can expect.
Wait, why do we have to use an X-ray? Isn't there any other technology we could use?
I don't think so. For this case, X-ray is probably the best because you can look through your inside your body. Some options, some examples actually are to view an area where you're experiencing pain, monitor the progression of a disease such as osteoporosis, see the effect of a treatment treatment method. But in this case, his is view an area where you're experiencing pain. So your right arm's hurting still, right?
Yeah, it hurts so much.
Yeah, so this is why we need to use an X-ray over all the other technology.
I mean, I'm all for doing X-ray, but can you tell me how does it affect my body?
Well, as I said before, the radiation is probably safe for adults, but not for growing fetuses. So, I'll probably inject you with a contrast dye before the X-rays, so this will improve the quality of the image. The dye is usually iodine. It can cause some side effects. This can include hives, some itching, lightheadedness, nausea, metallic taste in the mouth. And in very rare cases, The dye can cause a severe reaction such as anaphylactic shock, very low blood pressure, and cardiac arrest. Okay, I'm not trying to scare you. This is just the real deal. Okay.
That's nasty. So what are the pros and cons of this X-ray? Are there more cons than pros? I'm very keen about my health.
Well, to answer the question, they're relatively the same. But for pros, it's fast and easy to perform. It's cheap, at most probably $100. It's quick because it's a simple process of gathering information and doing operation itself. And it's probably sensitive to detecting calcium, air, metal, gas, which is good at seeing abnormal things in your body. For cons, it exposes such subject to radiation, which can cause many symptoms such as fatigue, extensive soft tissue abnormalities involving muscle masses, blood, water, solid tumors, etc. Changes in patient's positioning, moving around can make the image blurry, and as well a small increase of the possibility that a person exposed to X-rays will develop cancer later in life. So is that good enough for you?
I'll think.
Alright, so I'm a science teacher, right? So I'm really interested in all this X-ray thing. So how does it enhance the scientist in understanding the cells and cellular process?
Well, seeing the bones clearly helps me as a scientist by removing the objects such as flesh and other cells, as well stem cells, because bone marrow is the creation of stem cells, right? We really need that to help in the research for people who have other problems, to help them regain and repair other like cells, like muscle cells and all. You know that, right? You've learned that. You've taught your students that, right? Or are you grade 10?
Yeah.
Yeah, you are? Oh, yeah. You've taught your students that, right? Yeah, of course.
Go.
Alright, so I'm really concerned about the environment too, so is there any environmental impacts?
Well, as I said before, radiation is the biggest thing. There's very little and fairly safe to humans. Over time, it can be really dangerous. The damage it can cause depends on the level of radiation and the resistance of the organism. Is there any more that you want to know?
Go. Some people see X-rays as a bad thing. Is there any moral or ethical issues surrounding the X-ray?
Well, yes. There's a lot of minor things, but the major thing that gets everyone thinking is the radiation, since that is the biggest thing. It can cause cancer, hair loss, and all. So that's always on people's mind when they're thinking X-ray. That's the first thing that pops up. So yeah, are these all the questions for before we get to it?
Yeah,
pretty much.
I'm informed.
Yeah.
Yeah.
Right, let's do it.
Okay, let's do it. You ready for this?
Yeah.
Okay, let's get started. Beep. Okay, take a seat right there. Come on, big boy.
Okay, doctor.
Okay, let me put the sandbag to keep you still, man.
Thanks, doctor.
Place your hand on this ledge.
Okay.
Yeah. Stay still.
Okay.
Stay still. Okay. Okay, get ready.
I think it's good here.
Yeah. Oh, that's really nasty.
Doc.
Yeah, I think you're gonna have to wear a cast for 4 weeks to 2 months now.
It's a big crack, eh?
What happened here?
That's what happened when I go outside.
Did someone cross you off?
No, I crushed them. I fell.
Oh, okay. So let's get you wearing that cast.
Mm-hmm.
And let's go, and then you're done.
Okay.
Okay, let's go. Yeah. Well, there you go, buddy. You're gonna have to wear this every single day, okay? Every single day until June 2nd. Okay.
Thanks, Doc.
Yeah. So let's
I
get.
learned a lot.
Yeah.
I learned a lot about X-rays.
So don't ever let your son play basketball ever again, okay?
Alright, I'll
Alright.
just play soccer.
Oh.